Do you dread going to the dentist office, not because you think your teeth are bad, but instead you just don't want to face the disapproving looks because maybe you've slipped a little on your dental habits? That won't happen at the offices of my next guest. Joining me is Dr. David Verzella of Prairie Dental Excellence. Doctor, nice to have you here.
Thanks for having me, Gail.
You call your office a no-judgment zone, and I think that's very interesting. I never really thought about it, but I guess there are folks that are afraid to go into a dentist office because of that.
Yeah, I think a lot of patients who come into our office haven't been to the dentist for a long time, and they have anxieties about what we're going to think about them and their dental condition. So from the minute they step through our door, our staff is really well trained in just making them feel welcome and let them know that we're happy that they're just there.
What makes Prairie Dental then different besides that? How are you special?
I think that we're special in that we offer a lot of areas of dental care that many general practices don't offer and aren't able to offer. We do sedation dentistry, we do implant dentistry, and I think that we are able to provide a high level of those types of services.
Okay, let's talk about implants. They're becoming more and more common, I guess, as techniques improve and all these things. But I think there might be some trepidation out there in folks thinking it's painful, they don't last. Let's clear up some of those myths.
Okay, as far as the pain level goes, most patients tell us that their level of discomfort is far less than having a tooth extracted or having many other dental procedures done. We sedate the patient, we give them medications that prevent swelling, inflammation ahead of time so that they don't have a level of discomfort and swelling that you would normally think that might be associated with implant dentistry.
And the dental implant goes into, like a screw, goes into the jaw after the tooth is removed, right? And it becomes a permanent fixture.
Yes, it is. It goes into the bone, and once it is in the bone marries to the implant, and it is a part of your body at that point. And the bone doesn't really have nerve fibers in it, so the patients really don't experience discomfort associated with having an implant. And once the restoration is placed, the patient then feels as though the tooth has always been there. It doesn't feel different to them.
Mm-hmm. Which is different than dentures. And dentures are a removable piece. That's really more of the what most people are familiar with. What is the benefit to each of these, and does it depend on the person and their issue?
Yeah, everybody is different. Some people come in and they're missing a single tooth. So in their case, you would have an implant placed to replace that single tooth. Other people come in and they have no teeth at all and they're wearing dentures. And the issue with dentures is that they can be, particularly on the lower, they're usually loose, and patients have difficulty holding them in place.
Right.
They're embarrassing when they're speaking or eating. So having several dental implants placed, sometimes where the denture can actually clip into place, and the denture no longer moves around, is a big confidence builder for the patient.
So it stabilizes it. It acts so they don't move as much.
Yes.
And as you said, that depends on what the person needs. What about bridge work then? That's sort of then the in-between from dentures to implants.
Yeah, absolutely. And so with dental implants, if the patient is missing a series of teeth, then you can place several implants and actually bridge from one implant to another implant. In some cases, even a patient who is completely edentulous can have bridge work placed entirely so that nothing is removable at that point.
This is so interesting because I never thought of intermarrying the different procedures, but I can see how it would really be beneficial to people to have some of these, if it's, not one-size-fits-all type thing, but together they would work.
Right, and it really depends upon what the patient's desires are, what their budget is. So we're really cognizant of listening to the patient and really what they are interested in having when they come into our office.
Doctor, thank you so much for being here. Great education. Appreciate that.
Well, thank you for having me.